I wanted, and you know, the health sector in
Senator Cherargei, focus on what you were presenting.
I'm focusing. Even the health sector in Nyandarua, we must speak to it. I would have expected Senator May to tell us the poor health sector in Nyandarua. Instead
Senator,
of raising frivolous point of
focus
orders.
on your presentation.
Okay, but I'm saying on the issue of workers, but I'm saying when you visit, and I exited the point that on the western part, that is why we need to thank. We are in broad-based government, and we are not ashamed, and we are not fearful to say we are in broad-based government, led by His Excellency President William Ruto and Dr. Raila Odinga. I know, Madam Speaker, in fact, he's not deep state. He should have been with Waamunyoro in the US. Madam Speaker, and therefore, like the issue of protective equipments, Madam Speaker, issues like providing health workers with salaries, Madam Speaker, I'm told the account is that they are not even giving risk allowances or extraneous allowances for the work that our health workers do. Madam Speaker, you are aware, and at least we have one doctor in the house, Dr. Kalwale, that most of the doctors and health work on call. Some of them are even called during odd hours. When us, we are safe in our houses, Madam Speaker. So I want to believe that we must relook at the issue of health workers, Madam Speaker, and the County Public Service Board must be called to order, Madam Speaker. And I want to appeal to County Public Service Board because I have studied public accounts. I don't know why the yellow light is there, and yet they took away my time. Madam Speaker, what I wanted to say, the Secular by Public Service Commission say when you reach 60, you must retire. Unless you are God sent. That's what the law says, Madam Speaker. I don't know, in our county public service, I've been in public accounts, Madam Speaker. We have been there with you on some of the occasions, even in committees. The retirement age is 60. I was shocked, for example, in Garissa, Madam Speaker, the chairperson of County Public Service Board is over 60 years, Madam Speaker, who is supposed to be appointed, Ahmed Abdirahman, over 60. So how do you expect the violation of the law? Like, for example, what is happening in Garissa, Madam Speaker. So we must ensure the County Public Service Board ensure salaries, extraneous allowances, and Madam Speaker, protection. When I went to Kapsabet County Referral Hospital, I met some doctors who even have to send the patient to go to Kapsabet Town to buy gloves, then come and be treated, including drugs. The place is dirty. Madam Speaker, that is why most of our medical doctors and practitioners are dying, because they don't have protective gear. They don't have protective equipment to protect themselves, Madam Speaker. Even as we talk about salaries, as we talk about allowances, we must provide them with a good working environment that is clean, that is hygienic, that is safe for our health practitioners, Madam Speaker. I saw my friend Kebore and Chairman Peterson Washira, among others, even Dafchi Atela. They should push beyond salaries. They should ensure there is proper working environment, Madam Speaker. So when I visited Kapsabet County Referral Hospital, I visited a number of facilities in Nandi, Maraba, I was ashamed. You see bed sheets lying around, very dirty. And these are contaminated, and you expect a doctor to treat you. There is no light. I was ashamed because I've seen in Mombasa County Referral Hospital, in the report, and I'm happy the committee you did expose this, that they are leaking roofs. Leaking roofs in the highest cost general hospital has a leaking roofs. Leaking, like the one we used to have in JK. Madam Speaker, just to fix, to go up and just put an iron sheet with a nail. Do we need a scientist to do that? Do we need a professional, Madam Speaker? Because I can see like fixing curtains that we buy here in Isli. Coast General Hospital does not have curtains. They need Senate to direct them to fix curtains, Madam Speaker. There is also leaking roofs and hallways, so when it rains, it's like Turkana County Referral Hospital. It was flooded, including the whole place, Madam Speaker. Yeah, do you mean Senate has reduced itself until we are discussing leaking roofs of County Referral Hospital? The governor, Abdul Samad of Mombasa, must be ashamed. This is shame. This is in our report. It's shame. It's shame, Madam Speaker. How can you explain to our children in future that Senate sat to discuss leaking roofs? I'm saying that this is embarrassing. Then I know there's something else in Taita Taveta, in the health workers professionals. This one was in Coast County Referral Hospital, Madam Speaker. The issue of Utange Field Hospital should be addressed, Madam Speaker. The issue of perimeter wall. You know perimeter wall. Even when Nehemiah, Madam Speaker, in the Holy Book, do they need Nehemiah to go to Utange in Mombasa to assist in rebuilding the wall like they did to Jericho? Madam Speaker. And you know there are so many Sanballats who will tell them even if a dog stands on that wall, it will collapse. Madam Speaker, the governor of Mombasa must be ashamed of himself. And I think Boni Khalwale, since he's one of the practitioners of the medical wall, he should be the one calling out such individuals. We cannot sit here to discuss perimeter walls. Madam Speaker, on this report that we have looked at, I think I want to agree on the issue of elder sector.